Does it matter who performs your colonoscopy?
Absolutely, positively, yes. Absolutely, positively.
How so?
So I almost think, again, I've been doing this for a while, right? 25, 30 years. I think this was a little bit of a blind spot many, many, many years ago. But we've come to realize that, right, like not all endoscopists are created equal in a way. I mean, I'm not personally critical of anybody, but what we've learned, right, we've talked some today about cancer, of course, but we've also talked about polyps. And we just talked about colonoscopy as a test to look for polyps in the colon. Well, maybe it shouldn't have surprised us, but what we started to learn with studies that were done 15, 20 years ago is that there's like a big variation in how much folks detect as endoscopists, right? Like, so if you use this thing like called the adenoma detection rate, which is essentially like close to this other metric, polyp detection rate. It's like how often when I do a colonoscopy, do I find at least one adenoma? And again, I think it was a little bit of a blind spot, but what we found is not only is there a lot of variation in the ability of some endoscopists to find polyps, that really matters. There are studies that show that if you get an examination done by someone who finds more polyps and you compare it to somebody who generally finds less polyps, and then you look at their colorectal cancer experience after those exams, you're more likely to be found with cancer in the next few years if you had that low polyp detector person than the high polyp detector person. And again, this is not like, oh, this is one study he's talking about. No, there's a lot of data that shows that folks who find more polyps do a better job preventing subsequent colorectal cancer. So that, I would say, is the biggest part of the quality story. Now, there's other parts of the quality story as well, right? Like things that might be harder for you to know, but like hopefully you're going to a practice where when you get prep for the colonoscopy, the prep is generally good, right? Like, because if, you're going to a practice where the way they're prepping your colon, you don't have a great prep, well, that's not so great. So we have quality metrics internally about, getting good preps all the time. You also want your doctor to get all the way to the cecum, to the end of the colon. And so that's something called the cecal intubation rate. It's basically the rate in which I'm able to get all the way around the colon. That should be really high, like greater than 95%. So, there are different pieces of the quality story. There's something about prepping your colon. There's something about getting to the end of the colon. There's something about finding polyps while you're there. I think the other area, there's actually two more areas. There's a whole area of resecting polyps, but I think the other thing that's important too is after your procedure is done, there is a quality to taking that information, like what you found, like say I did find polyps in you. There are clear recommendations about when to bring you back. So hopefully the provider, the endoscopist who's doing your test is bringing you back at intervals that make sense based on what was found. What we've found is that there could be this kind of practice of, bringing people back at very short intervals. If I'm doing good, high quality colonoscopy and I just find one or two small polyps, I shouldn't be bringing you back in 3 years. The recommendation is 7 to 10 years. So all those things are part of the quality picture. Do I prep your colon? Do I get to the end of the colon? Do I find polyps? When I find them, do I remove them properly? And then once it's done, do I give you recommendations that are consistent with best evidence? And so, yeah, I think it really matters who does your colonoscopy.
So these different metrics that you've put out, like the different batting averages and what have you, is there a public-facing place that someone can access this data?
I've been asked this question before, and I think it's an important one, right? So first of all, the thing is called adenoma detection rate, right? That's what I'm talking about. So I'm repeating that because like if you want to find out what an adenoma, because I could say what the rates are. They're different for men and women, 40% men, 30% in women. Like no one's going to like remember that. But you can easily find it out, right? Right. We all have our ways.
It's highly searched.
It used to be Dr. Google. Now it's, I mean, let me tell you, Copilot's going to, I'm pretty sure, I haven't tested it. It's probably going to get it right? It's going to give you the right thresholds. But to me, if you have the opportunity to meet with your endoscopist, yeah, you know what? I don't even know if their answer so much matters. Of course it does. You want them to give you a good answer. But if you ask someone and say, hey, I know that quality is important. Can you just tell me what, do you measure adenoma detection rate in this practice? And what's, can you give me a sense of your adenoma detection rate? Like if that person was defensive or like, oh, I've been doing this for 30 years. I'm really good at it. Like if that's the answer, I would worry about it. I mean,
I imagine this is data that they would have to provide for insurance purposes, right? So I would imagine like every single.
Well, I mean, there have been efforts. Again, you're talking to someone who's a VA doc, right? So I'm not quite in the. I mean, my insurance is all. I mean, I'm not practicing for Blue Cross Blue Shield. I don't know everything that they do, but there certainly was efforts within various communities to kind of link pay to performance in various ways and have these metrics. But to be honest with you, I don't think most endoscopists have any, like there's not some common clearinghouse where you just go in and check, or the insurance company, if you call the insurance company, you can prove me wrong, but I don't think that that's commonly known. I think that's why it's hard to, I think this conversation just strikes home for me. It is hard to act on this guidance that I'm giving you, that quality matters. It is hard to act on it. But again, I think if you have the opportunity, and I'm saying if you have the opportunity because some of the time, right, we do what's called direct endoscopy. Like the first time you're meeting your endoscopist is when you're in the room. It's hard in that case. Maybe then when you're talking to that pre-procedure call, you could say, hey, I just want to make sure. I'm talking to someone in a practice where you guys measure adenoma detection, right? And if they are like, no, I'm not sure. And
what is that?
Yeah, exactly. Right. Like people's response to the question could speak volumes. And I guess the last thing for the VA audience, we do track this within VA. I mean, what you're saying, thanks to, again, it's not my work here. We have some really talented folks in our work group and informaticists and people work with data. We do have dashboards that show us people's and detection rate. And so we try to do our level best. And I'm telling you, again, in my practice, I mean, yeah, I was the chief of the section at my place for years. We've been tracking adenoma detection for years. So I feel confident recommending, certainly my practice, but VA practice. But yeah, I think the best thing to do is gently ask about it. And if people are defensive or don't know, that tells you a lot. And if they give you their level best answer, like, well, last time I did it, it was like 6 months ago and it was around 43%. Great. I mean, I wouldn't push it farther than that, obviously.
So I've had a colonoscopy performed, get the test results. Is there any way to know from the test results as to whether or not my colonoscopy was successful or not?
Whether or not they found polyps on your individual exam, right? That doesn't quite say too much because about 50% of the time they might not find an adenoma. This is a screening colonoscopy. But the things that you would look at is the extent of the exam. You want to be absolutely positively sure that it got to the cecum, got to the end of the colon. Oftentimes, I mean, it's standard for us to take a picture of the base of the cecum. I guess you could ask to see that. I mean, there's a little hole where the appendix drains out. That's the stop sign for us. When I see the appendiceal orifice, I know that I've gotten to the end of the cecum. So a picture should show the end of the colon. And then the quality of the prep. You can ask point blank, what was the quality of my prep? So for you personally, was it a high quality exam? Hopefully they're telling you the prep was excellent or good. If they're telling you it's fair or fair to poor, or I didn't see some areas so well, that would be a cue that it wasn't so great. And you should consider ask point blank if you need to repeat it.
So colonoscopy, to stay with all these athletic references, really is a team sport. Like it's just as much on the patient as it is on the person performing the procedure.
Yeah, it's a huge team sport. Even the people you're mentioning, right? Your role, becoming informed, getting ready for your test, following the instructions. That's the patient's role. The endoscopist has a role, right? Which is something about performing the exam, getting appropriate informed consent. But then we have other team members in the room too, just so people aren't surprised, right? Like there's going to be that nurse that talks to you before the procedure, oftentimes a nurse that kind of goes over your prep with you, goes over your medicines with you. So that's part of the team. You're going to get prepped when you come in. Again, in our section, we have excellent nurses doing all this pre-procedure work. And then in the room, there's often another technician, an extra pair of hands in our team, right? Because we're working with scope, and if we're taking out polyps, we have an extra person helping us with those kind of things. So it's a team effort, and but yeah, the patient has a major role being informed. I mean, honestly, and I mean this sincerely. Like, I've never had a patient ask me a question that I thought was out of bounds or not right or ridiculous. I mean, of course, like I have no anxiety about colonoscopy, right? Like I've been involved in thousands of them, but for many people, it's the first time they ever did it. So of course it feels awkward or feels uncomfortable. So ask those questions, and that will make you feel ready for the procedure.
You've got questions and we've got answers. Whether you served, are currently serving, are a caregiver, or a veteran advocate, the SITREP is your trusted source for information. Subscribe today at www.youtube.com/@VA Made Simple.